Hi, everyone. Welcome. We'll give folks another minute or two to join in since we just are getting started. Okay, well, hi everyone, and welcome to today's webinar. I wanted to quickly say at the top that this is off the record and closed to the press. And today's call is being recorded and will be shared with you all afterwards and will also be public on Family USA's website. I also want to note that we'll be doing questions at the end, so feel free to use the question and answer section to ask questions at any point, but just recognizing that we will be coming back to any questions at the end of the presentation and the speakers. So again, thank you for joining the Fight for Lower Drug Prices, How to Engage in Inflation Reduction Act Implementation. So after years and years for some of important advocacy from all of you and millions more, Congress passed historic legislation to bring down the cost of drugs. However, we know that the fight didn't end there and that industry, namely big drug companies and their army of lobbyists, are already hard at work to weaken or undermine the historic progress that we all made. So we wanted to take a moment today to discuss how and when advocates can continue to engage with the administration during the implementation of the IRA. Thank you to our great group of speakers that we have today. We're first going to hear from Catherine Harine about the real impacts the IRA will have for millions of older adults and people with disabilities who rely on Medicare. Erin Plotke from Families USA will present our recently released advocacy guide outlining how and when you can engage, particularly in light of CMS's recently released guidance on the negotiation process. And finally, we'll hear from Matt Hogan on new message findings on what the public knows and what messages have had the most impact. So with that, I'd like to turn to Catherine Harine, an Illinois native who uses Medicare to pay for the medication she needs to live and manage her health. Thank you so much for joining us, Catherine.
Thank you. Thank you so much. Hi, my name is Catherine Harine, as she said, and I am a single right lung transplant recipient, and I live in Wheeling, Illinois. I am one of millions of Americans who relies on medication to live and to manage my health, who will be helped when the Inflation Reduction Act goes into effect. Right now, the cost of my medication is so high that I've had to give up everything but the necessities. I do not go to the movies or out to eat. I don't go shopping, and I've given up all my hobbies. All of my money goes to pay for my medications and basic living expenses. My drug costs take up 25% of my income. As a transplant recipient, I have to take my medication or my body will reject my lung. All of my other medications are required to counteract the serious side effects of my transplant medications. I have to take my anti-seizure medications to avoid having a seizure and heart medications. I can't skip or ration these medications. I need them to stay alive, but I can just barely afford them now, and I'm spending more than I bring in, so I need help soon. I'm on Medicare, and I'm so thankful for the coverage that it provides. And the out-of-pocket cap on prescription drug spending will be important for me to help me keep more money in my pocket each month. Last year, I followed the debate in Washington closely and was so thrilled when the legislation passed, and I knew that I would soon see relief in the high cost of the medications that I need. I'm so grateful to those who spent years working on this effort, and I am eager to see this law go into effect, but it remains important to stay involved. The folks that tried to stop the bill in Congress will try to do the same with the Biden administration. I am hopeful that by sharing my story, I can spread the message that this law is not just about dollars and cents in Washington. It's about real people like me who are struggling to afford the medications we need to live. This is life or death for me. And today I'm filled with hope that Congress can get big things done and help lower drug costs for people like me who desperately need it. I hope you all keep up the great work and keep fighting to make sure this law does right by us. Thank you.
Great. Thank you so much, Catherine. Thank you so much for joining us and sharing your story. I think it obviously underscores the reality for millions of older adults and people with disabilities who we know are going to be positively impacted by the legislation. And it just highlights why it's so important to keep engaging and ensure that the bill is implemented to its fullest and there are no opportunities for big drug companies to weaken it. So thank you again. Really appreciate you being here with us. I think that's a great segue to Erin Plotke. Erin is the Senior Policy Analyst at Families USA and led the publication of our recent advocacy guide, which I know was shared in the invite, but I will also go ahead and share that in the chat once Erin gets started. Erin, I'll leave it to you to explain how folks can best continue advocating to the administration in order to ensure lower drug costs.
Great. Thank you so much, Bailey. And thank you both, Catherine and Matt, for being here, and for everyone, all the advocates in the room, for being here as well. Let me take a moment to share my screen here. Don't mind my technical difficulties. Great. Bailey, we can see this?
Yep, looks great.
Great. So as Bailey alluded to, we have spearheaded a publication that we released a couple weeks ago on ensuring the Medicare drug negotiation program prioritizes families and consumers. And so I think big picture, as has been discussed, we did it. We passed the Inflation Reduction Act. We gave Medicare the ability to negotiate drug prices with manufacturers, among a slew of other important drug pricing reforms. But I think the message here today is to say there are still critical decisions that need to be made on an administrative level, on a regulatory level, through the Centers for Medicare and Medicaid Services that, as advocates, we believe should be focused on, and to ensure that we get every ounce of benefit for patients and for families and for folks like Catherine and so many others that rely on Medicare for health coverage and for prescription drugs. And so this is a picture on the left, is just a screenshot of it on our website. You can find it at Families USA's familiesusa.org. You can also download a PDF of it. And so just to give you a sense of kind of the major sections of the resource, there's 4. So the first part is really just giving an overall background of the Inflation Reduction Act's drug pricing provisions. So including, a brief explanation of, in addition to the drug negotiation piece, the other things that the IRA has done in the name of lowering drug prices, such as the inflation rebate caps, enhancing the low-income subsidy for folks who are of low income on Medicare, and among other things. The next piece is an implementation timeline to just really identify for folks what are the key political moments, moments of opportunity that advocates can leverage and to use their voice to improve and making sure that the decisions that the administration is making in implementing this law are prioritizing patients. And so the next piece it's kind of the bulk of the resource. It's really identifying what are the key decisions that have to be made. And so what we did is we went through the Inflation Reduction Act statutory text for you. We identified through a lot of, I think, good thinking all around, what are those key areas that are still left up for the administration to decide upon that does have a very real impact on the extent to which this negotiation program will lower drugs for families and consumers. And then the last part is an appendix where we go into a little more detail on the Inflation Reduction Act statutory language, the legislative text, just to give folks, if they wanted to do a deeper dive and to understand on their own, what are some of the regulatory decisions? What is the legislative text saying? How does Medicare have to implement that text? That background at the end of the document is supposed to do that for you. And so just starting at the timeline, as you can see, we've laid out some key dates starting from a couple weeks ago, frankly, until the first set of drugs whose negotiated prices would go into effect, which is 2026. So just for a little context, this timeline is just focused on from now until 2026. But of course, it doesn't end there. For 2026, 10 drugs can be negotiated under the Medicare drug negotiation program. And then in 2027, 15 additional drugs can be negotiated. 2028 is there's 15 Part B and Part D drugs, and so on and so forth. But really, this timeline is just to give you a sense of the starting point here. And so I'll just highlight a few of them, but you'll notice on the left, there are these little public comment opportunity icons, little speaker phones that are just supposed to highlight for you where are the formal public commenting opportunities based off what the legislative text says, based off what CMS has said so far, are the times roughly that we will, as advocates, have an opportunity to publicly comment on some of these decisions and implementation. And so right now, to start us off, a couple of weeks ago, CMS did release a significant proposed guidance memo proposing a bunch of different aspects of implementation of the Medicare drug negotiation program. And we scheduled this briefing, this webinar in light of that timing. And so, just to flag for folks that draft got those comments to CMS are due by April 14th, 2023. You also notice sometime in the spring of 2023, there'll be some additional public commenting opportunities. These are referred to as data collection processes, and those are really about giving CMS some input on what are the types of information and the way that information should be collected by the federal government to inform the negotiation process. And so we'll get into a little later what some of that information could be, but just to say that's what the spring 2023 date is referring to. And then the last key date is the October 2nd, 2023 date. And really what that's for is to say that's the deadline for when drug manufacturers have to submit certain information to CMS as it relates to the drugs that CMS has selected for negotiation during this process. And so there should be, according to CMS, some opportunities for the public at large to also provide opportunities or to provide additional information on the drugs that are selected for negotiation to inform exactly what price would be set by Medicare during the negotiation process. So the next section is just going through, I'm going to go through each of the 5 key decisions, regulatory decisions that we've laid out here. But this is kind of just a comprehensive list. So key decision number 1 is whether CMS continues to give consumer and patient advocates an opportunity to review and comment on negotiation policy decisions. And so we left that here because according to the Inflation Reduction Act, well, let me back up. Typically, as you can imagine, an agency in implementing a law would have to give a public commenting, a proposed rule period and public commenting opportunity with that proposed rule, and then finalizing that rule based off the public comments. And so in the case of the Medicare drug negotiation program, the Inflation Reduction Act required CMS to go through sub-regulatory processes, which doesn't require them per se to give public commenting opportunities for the public. And so we put this here as a key decision because we think it's really important that regardless of what the IRA is requiring CMS to do in terms of not using a formal public commenting period, we do believe they should give opportunities for the public to comment regardless. And so when we've reviewed their most recent proposed guidance, we did see, and we're happy to see that CMS is voluntarily asking for public comment and giving folks that opportunity. And I think just to end, it's something to continue to keep an eye on as they implement the program throughout the process. So key decision number 2 is really about, okay, now that CMS has selected certain drugs for negotiation, how are they actually calculating the price, the ultimate price that would be used for those drugs once they are negotiated with the manufacturer? And so the Inflation Reduction Act legislative text is very, very non-specific on what that process would look like. So it really gives CMS a lot of discretion. The only thing it does say is it requires CMS to consider 9 different factors to inform what the price ought to be for those drugs. And so you'll see on the right, that's what we lay out here. There's kind of 2 categories of information: manufacturer specific information and evidence about alternative treatments. And so the manufacturer specific data is things like research and development costs, the extent to which those have been recouped via profits and revenue, the actual unit cost for drugs, and other market data and revenue and sales information. The evidence about alternative treatments is more about looking at the clinical value of the drug that's being selected for negotiation. And so it's things like, to the extent that a selected drug is more or less clinically or therapeutically effective compared to other treatments or other drugs that are treating the same condition or the same diagnosis. And so I think in this key decision, I think overall it's a very important moment for advocates and for the public at large and for patients as well to really give CMS a lot of input as to how should CMS use all these different factors to arrive at a price? What is the most fair, equitable way that achieves the lowest and fairest price for patients and consumers? And so I will flag that in CMS's proposal, recent proposal that they released a couple weeks ago, proposing to implement some of these decisions, they've decided to use to anchor the price, the calculation that they want to use to arrive at a given price for a negotiated drug by using net Part D prices. And so essentially they want to use the prices that are already being negotiated in the Part D plans through the PBMs. And so I think it's something that we're concerned about, and that we would look for, we are certainly planning on giving feedback on that particular proposal by CMS. And I think all to say is that using net Part D prices, given that those prices are set in a market that's already, with prices that are already wildly much higher than other countries, as well as Part D prices being much higher than other payers of drugs, such as the VA. And so I think our concern is that to use those prices that are already being paid for by the program, is not really in the spirit of getting the lowest and the fairest price for these drugs. So the next key decision is about how CMS is ensuring that the information from drug manufacturers is accurate and complete. And so all to say here really is that, as mentioned, there's going to be a lot of information that drug manufacturers will need to submit to CMS to inform these negotiations. So for instance, the unit costs of the drug that they're selected for negotiation, or the extent to which they've recouped their research and development costs for those drugs. And there's a real risk that pharmaceutical companies and the industry at large are going to look for ways to game those reporting requirements. They've done it before. We have clear evidence with certain reports from oversight groups and other government watchdogs that they've done this type of gaming of reporting in the Medicaid drug rebate program. And so we're really concerned that and want to make sure that CMS is doing everything they can to ensure that there's the information they're using, whether it's from drug manufacturers or not, is verified, double checked, and audited for accuracy and completeness. And so again, just to kind of connect it to this recent proposal from CMS, they didn't give a lot of indication that they were going to double check or verify or audit the information that's coming from drug manufacturers for these negotiations. And so it's just another area of concern and another area that advocates should really be focused on and scrutinizing the administration in terms of how we're moving forward with implementation. So key decision number 4, it sort of dovetails with key decision number 3. It's essentially to say the amount of detail and the manner in which CMS is publicizing the ways in which they're arriving at their maximum fair prices and other decisions they're making as part of the negotiation process. And so, you know, per the Inflation Reduction Act, CMS is required, once they've negotiated prices for certain drugs that they've selected with manufacturers, they need to publicize not only the prices that they land on, that they arrive at, but also a justification of how they arrived at that price. So in writing. And so, of course, very important, I think, to making sure that the amount of information and detail of the information that CMS is publicizing around these decisions is as much and as maximized as possible. And this is good for oversight, of course, and making sure the program is really, you know, doing what it was intended to do, but also giving that information out. It sends signals to the private insurance market as well, and can help lower drug prices in the insurance market. Because as we know, technically this negotiation program and these negotiated prices only apply to the Medicare program, but to the extent that we could, through publicizing this information about the negotiation process, being able to also positively impact patients who rely on employer-sponsored coverage as well. And actually, let me just stick here for a second. And again, just to bring it back to this recent proposal from CMS, right now their thinking is to only provide high-level comments to the public as it relates to justifying how they arrived at a negotiated price for these drugs. And so another area, I would say another area of concern is that we want to really push the administration and push CMS to give as much information as possible for the reasons we just outlined earlier. So the last decision here, key decision 5, is how CMS uses the renegotiation process when previously negotiated drugs are changing in ways that warrant an updated negotiated price. And so essentially here is to say, starting in 2028, if a drug that was negotiated for, say, 2026 or 2027, maybe something changed about that drug. Maybe the clinical value went up or down. CMS has an opportunity based off the IRA to renegotiate that drug and arrive at a new price that is, you know, based off this new information, is fair and equitable. And so I think the message here, our suggestion would be to say, let's really push CMS to use this renegotiation authority as much as possible. So those are the 5 decisions. This is the last thing I'm just flagging it really briefly here, is to say at the end of this resource, we also have a more detailed statutory background of the legislative text of the IRA. And so for folks who want to get into the weeds there, we definitely welcome that, and we've provided what we hope to be a helpful reference to some of those details. So with that, I will open up to any questions, or if we don't have time, I'll bring it back to Bailey.
Thanks, Erin. I think we will actually wait to do questions at the end so we can capture questions that folks have on anything. Also, you are still screen sharing, by the way. Okay, great.
Sorry.
Just wanted to give you a warning. Okay, awesome. Well, thank you very much for that very thorough walkthrough. I'll just note that Families USA is working on taking some of the recommendations on the recent negotiation that CMS released on getting folks essentially a document that outlines the recommendations and some of the things that we support and some of the concerns that Erin had discussed to you all. So and I think it just goes to show that not only that there are going to be many important moments over the course of the next year, but there are also immense opportunities for advocates to stay involved and have a real impact on CMS decisions. We know that it's equally important to continue to do public outreach so folks know how this law will help them and that we can continue to combat big drug companies' very active public narrative against the law as well. So we're happy to have Matt Hogan joining us. Matt is currently a partner at Impact Research and has been doing polling work for the Democratic nominees in the past 4 US presidential elections, including polling in both the primary and general for President Biden and President Obama's 2012 reelection. He's also worked with the Democratic Governors Association and Democratic Senatorial Campaign Committee and has extensive experience polling on issues such as healthcare, education, tax policy, immigration, and election reform. So Matt, thank you for joining and being here to discuss your recent polling about the IRA and lowering drug costs.
Great, thanks Bailey, and thank you all for having me. I'm just gonna share my screen here. So I'm going to run through some poll results. The poll data I'm going to go through, we conducted it in December, mid-December, and it's a big sample. It's 2,700, over 2,700 registered voters. All voters just were over the age of 50 plus. But I think, as you'll see, I think the findings here are really really applicable to the entire electorate, and notably, we did big oversamples with Black, Latino, and AAPI voters, giving us at least 500 with each of those voters. So a really robust sample size here to look at. So I just kind of want to highlight a few kind of key findings from the polling. One, I think one of the most important things, and I don't think terribly surprising to folks, but maybe the degree is just the knowledge about the changes in prescription drugs from the IRA is really very limited, even among these 50 plus voters who are more aware of the changes than younger voters. The awareness is quite low. You have about 2/3 of 50 plus voters who they said they've heard very little to nothing about the changes, and only 6% said they have heard a great deal. We also asked about awareness of specific aspects of the law, and we see similarly low awareness here as well. The most well-known aspect of the changes was the change on insulin that'll limit it'll cap the cost for insulin for those on Medicare to $35 a month. But even that, the most well-known component, was only familiar to half of 50 plus voters. Of the other prescription drug changes that we tested, knowledge was basically 40% or less, with the penalty for drug companies raising their prices faster than inflation, especially low, with only 1/4 of 50 plus voters being aware of that. So I think we just need to operate under the assumption that the vast majority of the public knows very little about these prescription drug changes. It is extremely critical that they do learn about these changes because they are really popular. We tested 6 different aspects of the changes specifically related to prescription drugs, and each one is overwhelmingly popular. At least 3/4 of voters supported each of the prescription drug changes that we tested, with at least about half or more strongly supporting these changes. And I think what is potentially even more notable is in addition to their broad support, the support is nearly as high among Republicans in this first column here as it is among Democrats. So not only do we see really strong support, but this strong support extends across partisan lines. All of these changes related to prescription drugs are extremely popular. The ones that are most popular is the cap on insulin costs, that it makes, recommended vaccines such as shingles, free to those on Medicare, and that it penalizes drug companies for raising their prices faster than inflation. So these three are especially important to highlight. But all of these components, including, of course, the out-of-pocket cap and allowing Medicare to negotiate lower prices, also extremely popular. So the most important thing is just communicating these to voters, again, given the low awareness of them. We see the impact of communicating these benefits, these changes on this slide. This slide just shows those who had actually heard about the changes. So among these voters, the changes were popular. 65% viewed the law and changes favorably. But even among these voters who are higher information and had heard about the changes, when we told them all 6 of those specific aspects, we still see a significant increase with them, with a 20-point net increase in support, with 82% supporting the changes after the information. So even among those who have already heard about the law and the changes, that telling them about all of the specific benefits has dramatic impact. And of course, the impact is obviously much more dramatic among those who have not heard anything. Always helpful, as we know, to have a foil, and in this debate we have a clear one. We tested views towards both big drug companies and pharma, and we do see that there actually is a big difference in the terminology we use when we're talking about our opponent. It's much more effective to talk about big drug companies than it is to talk about pharma. We see up top here, over 2/3 of voters have a negative image of big drug companies, including over 1/3 of voters who view them very unfavorably. And notably, this is one thing I thought was particularly surprising. There's just as much, negative views towards big drug companies among Republicans as there is among Democrats. So this is kind of a bipartisan sentiment, these negative feelings towards big drug companies. We also tested views towards pharma, and while a plurality of voters viewed pharma negatively as well, there's just less familiarity with that name and terminology. You've got over 40% of voters are not familiar with the term pharma. And this, this extends across partisan lines as well. So when we're talking about our opponents, much more effective to use big drug companies as our opponents than to refer to them as pharma. We also tested, a couple arguments from big drug companies, and those didn't get a lot of traction with voters. By a 32-point margin, voters, or 35-point margin rather, voters 50 plus reject the notion that the price cuts on prescription drugs will have a negative impact on prescription drug innovation, with 58% disagreeing with that statement and just 23% agreeing with it. We also see, a similar example when we ask about what's the bigger cause of the rising drug prices. Is it drug companies price gouging patients, or is it R&D costs? And overwhelmingly, by about a over 4-to-1 ratio, voters say that it's drug companies gouging patients that's really driving costs, not the cost of R&D. So really not much traction for this big drug company argument. That these changes will result in less innovation. That means we give a little kind of suggested message here that, after many years, we have finally made progress on Medicare negotiating lower drug prices, something big drug companies are trying desperately to overturn. We need to fight to make sure the negotiation process keeps moving forward. While the changes on Medicare and prescription drugs are very popular, especially once voters learn about them, the voters are much more mixed on the IRA law itself. 45% of voters support it. 37% of voters oppose the law overall. So while you have plurality support, much less popular overall than the prescription drug changes themselves. While the IRA law is, not surprisingly very popular among Democrats, it's underwater among independents and Republicans. And, as I showed earlier, those prescription drug changes are really popular across the board. So given this and the kind of, unpopularity of the IRA with these audiences, we really recommend, not talking about these prescription drug changes in the context of the IRA because it will hurt their approval among independents and Republicans. Finally, just wanted to leave some messaging takeaways based on the poll. One, again, assume that the vast majority of voters is not aware of these prescription drug changes. And it's really critical, obviously, that we communicate them. We recommend leading with the savings and the insulin cap and the free vaccines for those on Medicare. Promoting the inflation penalty that will keep big drug companies' price increases in check. That is the least known of the benefits that we tested, as well as talking about the $2,000 cap on out-of-pocket costs. All of these can help demonstrate how these changes are help lowering costs on prescription drugs for regular people. We do want to, have a foil and an opponent in this argument. Highlight how big drug companies, not pharma, are trying to overturn these changes. We don't want to link these changes to the IRA. Again, just keep them focused on what's happening with the prescription drug changes themselves. And finally, we don't want to while we want to highlight the progress we've made. We don't want to be seen like we're spiking the football. We want to demonstrate that, this win has taken a long time, but it's still a work in progress. And we need to continue to fight and oppose the big drug companies' efforts to stop these changes so we can continue to lower drug prices for average Americans. So those are kind of the key takeaways from the poll. Bailey, I will turn it back to you.
Awesome. Yeah. Thank you so much, Matt. Just so much helpful information there. I will say I myself constantly have to correct myself to use big drug companies when using any public facing documents, because I think we all got in the habit of using certain language. So, I think it just goes to show it's important for all of us to continue the public outreach that we're doing to make it clear like what impacts this law will have and the provisions that are, so popular, but people don't know about. And it just shows that we have the support from the public in the work that we're doing. So it's just critical to continue to fulfill the promise of this legislation, to make it clear that these big drug companies are trying to push back on the progress that we made and how important it is for all of us to continue to engage with CMS and engage with this process. So, we've got about 20 minutes left, which is a pretty decent amount of time. So would love to open it up for any questions for our speakers. So I actually have seen a few questions already in the Q&A. Again, feel free to use that Q&A function to drop some questions in. So the first question says, given the large number of drugs being used and the small number of drugs a year that may be impacted by the IRA process, how important will this be to lowering prescription drugs for most seniors or persons with disabilities? What % decrease in aggregate drug costs can we hope for? That's a great question, Anne, and that's a question we'll have a better idea for in the coming months. The precise drugs that will be negotiated will really determine the answer to that question, honestly, which we will have an idea of September 1st, I believe. Aaron, is that the date that they will be announcing the specific list of the first 10 drugs?
Yes, that's right. And I think it will be, it's September 1st, 2023. We'll know the first 10 drugs being selected. And Bailey, I'll also just flag, I think, we do know the Inflation Reduction Act was very prescriptive as to what types of drugs are selected for negotiation. And so basically, in a nutshell, Medicare is required to negotiate the top, like the most expensive drugs in total dollars spent overall. And so to the extent that, CMS is doing that, I think it will have a sizable impact for a lot of people. And we also know, based on other research, that there are a relatively small number of prescription drugs that are really accounting for a large share of Part D spending. So I think, like Bailey said, like it's not an exact science. It's hard to know exactly for sure, but I think even the first 10 drugs and then the subsequent 15, 20, so on, I think in a couple of years, the impact will be rather significant.
Yeah, and two quick notes to that. One is the negotiation and the money saved by Medicare from the negotiation on those drugs is being used to pay for the out-of-pocket cap and for the free vaccines and some of these other provisions that we know are, as Matt showed, like extremely popular because they have such tangible impact. So I think we don't want to look at like the savings from Medicare negotiation as like the benefit all on its own. Like the savings for Medicare is also providing these other benefits as well, which I think is important to communicate because Medicare negotiation itself is kind of like a weird technical thing that like folks might not necessarily like even quite know what that means. And I think the second point is that it also just goes to show kind of something else that Matt brought up, which is that there's a lot of progress that needs to be made. Like this isn't like we did it and move on. The law was pretty restrictive in the types of drugs and how many drugs could be negotiated. The president's budget outlined policies that would open up both how many, like to make more drugs available to be negotiated at any given time, as well as to address getting drugs negotiated faster. So I think these are the types of things where, we definitely want to continue to have conversations about and push on because we want to make this as effective as possible for as many people as possible. Thank you so much for that question, Ian, and thanks, Aaron. Okay, we have another question that says, I recall hearing and seeing a lot of Democratic members of Congress talking about the changes and doing events in their districts, social media, etc. Are there any further indications as to why the information is not getting out there? I don't know, Matt, I assume is there anything that came up in your research?
Well, I mean, I think it's consistent across all issues. It's not specific with this one. It's just, I think, especially in this, the media environment we live in, it's just really hard, to break through without some, national ad campaign. So I think the key is just to continue to just, beat the drum and just get that message out there however we can, so that we can continue to kind of see that kind of like incremental, increase in awareness. Look, we saw the same thing with like Obamacare, where, early on there was very little awareness about, the pre-existing condition piece, and now everyone knows about it. So it really is, I think, just demonstrates the importance of just doubling down and taking for granted that people know about this stuff, because they really don't. But we can make progress if we just keep communicating on it.
Can I ask a question?
Yeah, no, please go ahead, Catherine.
Is some of this lack of information because young people are young and healthy and don't care about this stuff, and it's those of us generally speak, I mean, there are young people who have chronic health conditions. I have a young niece who has very life-threatening health conditions, but the majority of people that we're talking about are probably seniors on Medicare who have to take medication, and we can't seem to get, I've noticed on social media that you can't seem to get young people interested in, anything to do with like the Affordable Care Act, getting, having insurance. They just think they're bulletproof and it doesn't apply to them. And that's just my personal opinion. I think that's part of the problem with getting this information out and letting everybody know that it's important for everybody, because you can get diabetes, you could be born with diabetes, and, for example. And so anyway, that's just a thought I had.
Yeah.
that, and I was just notified I have a copay of $378 in my bank for one drug.
Yikes.
Yeah, yikes is right. I think I might have to move some money.
Well, Matt, I don't know if you had any thoughts on the first part, and I know your research was specifically for folks that were on like 50 and up, I believe you said, but I don't know if there's anything else about the research you found.
Yeah, look, I mean, we consistently see across most issues that awareness on most issues is lower among younger voters. You know, they're just, you know, less likely to consume news than voters 50 plus. But I think one of the key takeaways from our polling is even among these 50 plus voters that are most likely to benefit from these changes, awareness is still pretty low with them. So, you know, we don't even have the data on the younger voters. I'm sure it would be, I'm
Yeah.
confident, much lower. But I think that's something to keep in mind, is that we can't take for granted that, like, oh, the 50 plus and the seniors know that. It's like they don't know it either. So it's just important to communicate to across the board about all these important changes.
Yeah, I mean, the Republicans, now that they have the House, the Senate, they're just trying to, you know, there's so much blowhard stuff going on. Even the elderly who are voting against their own best interests, I think is a situation that applies as well. If correct me.
Yeah. Oh, I was just gonna say, I think it just goes to show some of the stuff that Matt talked about and why it
Yeah,
is just so important to
exactly.
continue talking about.
That's
We do
the
have,
first thing that popped into my head when he was showing some of his statistics, was that, you know, people who need this the most are not paying attention and they're voting against their own best interests.
That's right.
can't comment on that last part, but we do have another question in the chat that I am going to run to. But thank you for raising that, Catherine. It's always important to remember the various audiences and making sure that we're getting through to all of them. The next question is wondering if we push for really clear and detailed written reasonings for how CMS got to the final negotiated price, are we simply giving big drug companies the details they need to game the system when they are doing their detailed reporting to CMS required under the law? Erin, I don't know if you have any thoughts on that, and happy to.
Yeah, I think it's a great question. I think it's a very legitimate, valid concern. And I think, you know, I think it, in some ways, it's a necessary evil when it comes to, we want as much public oversight and awareness and opportunities for comment on how this negotiation process would go. And I think for CMS, in publishing a proposed process, you're absolutely, I think that's absolutely right, that there's a risk that drug companies or drug corporations are going to you know, do everything they can to game the system once they know what the rules of the road are, if you will. But I'm not sure. I wonder, though, I think the benefit of the public, including advocates and patients, having an opportunity to contribute might counterweight or outweigh the concerns of industry gaming. So I guess what I'm saying is I'd rather have it all public with some gaming risk than no public with no gaming risk, but also then no opportunities for you know, public comment from the folks who are stand to benefit the most from this program.
Yeah,
but it's not, no doubt, a tricky situation. Go ahead, Bailey.
Yeah, I'll just add, like, one thing that we know about big drug companies is they have a lot of money from all of these high cost of drugs that they've been selling. And they have very well paid teams of lawyers to figure out how to game all of these systems already. And to Erin's point, like, I think having more transparency is always better, because at least then those of us from the consumer, or like folks who are, you know, actually in touch with the folks who are going to benefit from this law, the more information we have and the more knowledge we have of what's going on, we can highlight that gaming and be able to create accountability for that gaming, versus just like having obscurity of not knowing, like, well, is this happening because there was just like something that happened in the back conversations of negotiation between CMS and these companies, or is it clear that these companies are gaming the system, which is why we in our key decisions are pushing for as much transparency, as much public opinion as we can possibly get, to be able to kind of like create transparency and create light in that situation, so we can understand if there's gaming occurring or if there's just like something actually in the minutia that caused that to happen. But great question. I mean, yeah, as Aaron said, it is always like a little bit of a tricky back and forth of figuring out how to do something helpfully without giving like too much opportunity for them to take and run with it, because we know that literally any opportunity they have to create a loophole or to get more money or to get around the rules, they will. So we have another question which says, will this have a positive ripple impact for those not on Medicare, or could there be a negative impact by price shifting? I think both great questions. Happy to give like a top level, and then Aaron, let me know if there's anything specific. So I think for the first part about positive ripple, I think it kind of depends on how the negotiation process goes. I think ideally we will see that private payers are able to take these negotiated prices. As Aaron said, the public, or the final price for the 10 drugs that are being negotiated and the subsequent drugs after that will be public. And I think that gives a really important opportunities for private and commercial payers to use that as a way to negotiate their own costs, since that's how, you know, we see the rest of the healthcare pricing market work, where Medicare pays a price that's public, and then other payers negotiate based on those rates. But I think the second part is also a risk. As Aaron mentioned, there's an inflation rebate in Medicare, so drug companies cannot increase the cost of their drugs year over year higher than the cost of inflation. Unfortunately, due to congressional inaction, they did not extend that into the commercial market. So I think we definitely have concerns, and it's, you know, it was in the president's budget as well. And it's something that we are fighting for a legislative fix to, but I don't know, Aaron, if you had any thoughts on that.
Yeah, no, Bailey, I think that's a perfect kind of summary of the state of play. I would just, you know, add that in addition to pushing for, you know, more structural legislative policy fixes to that risk of cost shifting to the commercial side, I would say, you know, as advocates, also really, you know, paying attention to what are the prices being set right now and over time by various, you know, medications and drugs. And I think to some extent that name and shaming, it does have some impact. It's not perfect, it's not comprehensive, and it's not like a policy that's, you know, uniform, but as maybe from a harm reduction perspective to help, you know, stop the bleeding a little bit of that cost shifting, I think, you know, paying attention to how prices are changing, if price gouging is happening at an increasing rate on the commercial side is important.
Yeah, thank you so much for that, Aaron. I'll give it another minute or two for further questions in case folks have another one that pops up. I will just say, while we're potentially waiting, again, reminder, CMS had released this guidance on March 15th that had a lot of tie-in with some of the key questions that we had outlined in our advocacy guide. Those comments are due April 14th, which is a week from Friday. We can share the specifics on the email. And then, as I mentioned earlier, Families USA is working on essentially taking the recommendations throughout that Aaron had already mentioned about our reactions to that, and putting that into a document that we hope are helpful for folks as they're putting together their responses, because, you know, as Aaron mentioned, it's just so incredibly important for us all to take every opportunity we can to both applaud CMS when they're doing really great things, because it's always important to provide that support, and then also be sure that we're making it clear when we have concerns that this won't, you know, be creating the lowest price possible for as many folks possible. So we'll be sharing that with folks in follow-up in the coming days. But seeing no further questions, I'll just say thank you again so much to our wonderful speakers, and thank you so much for the helpful content. And we'll be sure to get this recording and potentially the slides to folks and follow up as well. So have a great rest of your Wednesday, and yeah, have a great one. Thank you again.
Thank you.
Thank you, everyone.
Thank you.